Hello, this is Dr. Lewerenz at Longevity Health Institute. As always, I hope this finds you well, but if not, we're here to make you well. Here at Longevity Health Institute in Rochester, Michigan, we specialize in personalized functional medicine. So we get to root causes and root issues of what you're suffering or being debilitated or surviving with, not thriving with, or resolving. So let me give you a little insight into some pain treatments, pain natural therapies, things that are really can impact pain. So how do we solve your pain? So when you come to us here in any of my practices, me or my practitioners will always approach you with a functional approach, a personalized approach into looking at systems. And when you deal with pain, we gotta always consider inflammation, diet, gut health, hormones, stress effects on the body, sleeping patterns. But let's say you have some chronic degenerative arthritic wear and tear, aging, and or rheumatoid arthritis, ankylosing spondylitis, inflammatory conditions to joints, even like lupus, things that can cause damage. We're going to take that systematic approach. We're going to look at you very personalized, but also there's some key things that I see so wonderfully benefit patients, including today. I actually had one fairly young, 52, I think 53-year-old female with rheumatoid arthritis, fairly new patient, and she's doing wonderful with some testosterone replacement pellet therapy. We get higher levels of using the hormone testosterone, and yes, women, as you've watched me and learned, need some testosterone. You don't need a lot, but you need a little bit. It's very anti-inflammatory, helps drive the brain, helps your immune responses, builds bone, builds muscle, helps metabolism. So a lot of wonderful things. But what's key in that patient is when you have low testosterone and you're the lower quartile or even lower for age, we often find that your inflammatory markers will be high, and if you're suffering from any type of debilitating, degenerative, inflammatory, arthritic condition, you will suffer with pain. There is a study on substance P and testosterone. Substance P has to do with signaling in pain, and without getting too detailed, when you elevate testosterone, people can tolerate effects and negative things happening in their body from pain with substance P. So anyway, let's get your testosterone up. We often use a testosterone pellet therapy, which is a subcutaneous placement of testosterone that can last 3-4 months and does wonderfully. It's physiologically gently released into your fat subcutaneously, and you can get very nice therapeutic levels. The other thing, those that we consider also looking at systematic approaches, is there's many herbals that can help pain. There is curcumin. There is your omega-3s, whether they're in a plant or fish-based, as long as they're good quality, okay, and mercury and metal tested. Diet and gut health are huge, okay, but there's also other herbs like cat's claw, wonderful for pain and inflammation, and often something called SAMe, S-adenosylmethionine, that raises dopamine and helps you tolerate pain better, plus enhances mood, plus it's a methyl donor, so it helps detoxification. That's SAMe, S-adenosylmethionine. That can actually help tolerate or deal with chronic pain. That supplement, it's actually a methyl donor. And then thirdly, let's say you needed some treatment. Well, we do ozone therapies, PRP, platelet-rich plasma therapies, which are very regenerative, anti-inflammatory. When you're talking about a specific joint, give you some pain therapy, some healing ability, but also if you have something there that potentially could be regenerated, you have that potential also. And those can sometimes take 2 or 3 different treatments, but very effective. What I like is the whole approach, meaning you're actually taking a personalized approach at somebody's systems, balancing them well, and also offering them some supplemental therapies, whether it be herbal, hormonal, or if we have to get invasive, like an injection of ozone or platelet-rich plasma. So hopefully this is insightful. I'll tell you probably the most profound thing is balancing somebody's hormones, particularly testosterone, if you're dealing with pain and inflammation. So very key. As a side note, and this is more specific and unique, but often we'll even find in a man, if you elevate testosterone, not only is it lovely to help pain and help many other conditions as well as quality of life. But you do have to watch a man's estrogen. If estrogen rises with testosterone slightly, it can be beneficial if we're just talking about pain. You don't want high estrogens, but if they stay into a decent therapeutic or upper quartile, that means a little bit higher estrogens. Often, if it's a tendinous, ligaments, muscle type of pain, it'll help their pain. Where if they have too low of estrogen, again, this is men, too low of estrogen, where it's blocked, or they have such lean body mass, or they're taking something pharmaceutical or supplemental that'll lower estrogens too much, they'll often get stiff and tighten and sore and achy. So you don't want too low estrogen, you don't want too high, you want it balanced. That's what we call a personalized approach. So this is Dr. Lewerenz. Hope you are enjoying your summer. Hopefully this is enlightful, educates you, share with others, get somebody well, lead them in the right way. You can find all of our wonderful supplements on our website. They're all medical grade, pharmaceutical grade supplements, the ones I mentioned. And you can go to our website, order them right on there. The access code is HEALTH, HEALTH. If you have any trouble here, you can call the office, 248-548-3060, or 248-289-6643. Like I said, or just look us up on our website, Longevity Health Institute, Inc.com. Again, this is Dr. Lewerenz. Be well.